Congratulations on taking this exciting step towards your nursing career. The NCLEX exam is your gateway to becoming a licensed registered nurse, and we're here to help you succeed. Among the many challenges, prioritization and delegation stand out as crucial skills tested on the NCLEX. These skills are essential for every registered nurse, ensuring that patients receive timely and appropriate care. Mastering prioritization and delegation is not just about passing an exam. It's about developing critical thinking abilities that will shape your nursing practice. This essay will guide you through these concepts, providing clear explanations, practical examples, and helpful tips to boost your confidence for the NCLEX. Remember, with the right preparation and a positive mindset, you can conquer the NCLEX and embark on your rewarding nursing journey. In the fast-paced world of healthcare, nurses are constantly faced with multiple tasks and competing demands. This is where prioritization comes in. It's the ability to quickly and effectively determine which patient needs attention first, second, third, and so on. I think of it as organizing your to-do list, but instead of groceries and errands, you're dealing with patients' lives and well-being. Prioritization is not about doing everything at once. It's about making informed decisions to ensure that the most critical needs are met first. This skill is crucial for patient safety and positive outcomes. On the NCLEX, you'll encounter questions that test your ability to prioritize patient care based on their conditions, symptoms, and potential risks. To effectively prioritize in nursing, you need a solid framework to guide your decisions. Here are 3 key principles that will serve as your compass on the NCLEX and in your nursing practice. First, ABCs: airway, breathing, circulation. This is your first priority in any situation. Always assess and address any issues related to a patient's airway, breathing, or circulation before moving on to other concerns. Second, Maslow's hierarchy of needs. This psychological theory provides a hierarchy of human needs, with physiological needs at the base and self-actualization at the top. When prioritizing, address the most basic needs first, such as airway, breathing, and circulation, before moving up the pyramid to safety, love and belonging, esteem, and finally, self-actualization. Third, acute versus chronic conditions. Acute conditions are those that have a sudden onset and require immediate attention, while chronic conditions develop gradually and last longer. In general, prioritize patients with acute conditions over those with chronic conditions. Let's put these principles into practice with some NCLEX style questions. Question 1. You are caring for 4 patients on a medical surgical unit. Patient A, 72-year-old male with a history of hypertension complaining of chest pain. Patient B, 55-year-old female post-operative day 1 from a hip replacement requesting pain medication. Patient C, 30-year-old male with pneumonia requesting pain medication. Patient D, 48-year-old female with diabetes, scheduled for a routine dressing change. Which patient should you assess first? Answer: Patient A. This patient is experiencing chest pain, which could indicate a life-threatening cardiac event such as a heart attack. Question 2. A nurse is caring for a patient who is experiencing anxiety and difficulty sleeping after being diagnosed with cancer. Which of the following actions should the nurse take first? A. Administer a sedative as prescribed. B. Encourage the patient to express their feelings. C. Provide the patient with relaxation techniques. D. Educate the patient about their diagnosis and treatment plan. Answer B. While all options might be appropriate, addressing the patient's anxiety and emotional needs is crucial before focusing on other interventions. According to Maslow's hierarchy, psychological needs should be addressed after basic physiological needs are met. Section 5. Delegation, sharing the load, ensuring safety. Delegation is another vital skill for nurses, involving the transfer of responsibility for a task to another healthcare professional while retaining accountability for the outcome. It's like, assigning tasks to team members, ensuring that everyone is working efficiently and effectively to provide the best possible care. Delegation is not about simply handing off tasks. It's about making informed decisions about which tasks can be safely and appropriately delegated to others. This requires knowledge of the scope of practice for each healthcare professional and the skills and competencies of the individual you are delegating to. Section 6. The 5 Rights of Delegation, your safety checklist. To delegate effectively and safely, always remember the 5 rights of delegation. First, right task. Is the task within the delegatee's scope of practice and legal to delegate? Second, right circumstance. Is the patient stable, and is the task appropriate to delegate based on their condition? Third, right person. Does the delegatee have the necessary skills and experience to perform the task safely? Fourth, right direction, communication. Are the instructions clear, concise, and understood by the delegatee? And finally, right supervision, evaluation. Will you be available to monitor, supervise, and evaluate the delegatee's performance of the task? Section 7. Delegation in action. NCLEX scenarios and solutions. Let's apply the 5 rights of delegation to some NCLEX style questions. Question 1. You are the RN caring for a patient who requires a bed bath. Which of the following staff members would be appropriate to delegate this task to? A. Another RN. B. An LPN, LVN. C. A certified nursing assistant, CNA. Or D. A unit secretary. Answer. C. Providing a bed bath is within the scope of practice for a CNA and is an appropriate task to delegate to this level of healthcare professional. Question 2. A nurse is delegating the task of ambulating a patient to a nursing assistant. Which of the following instructions by the nurse is most appropriate? A. Ambulate the patient. B. Ambulate the patient to the end of the hallway and back. C. Ambulate the patient twice today. Or D. Ambulate the patient if they are feeling up to it. Answer. B. This instruction provides clear and specific directions to the nursing assistant, ensuring that the task is performed correctly and safely. Section 8. Mastering Prioritization and Delegation. Tips and tricks. Here are some practical tips to help you master prioritization and delegation. Know your ABCs and Maslow's hierarchy of needs like the back of your hand. These are your fundamental frameworks for prioritizing patient care. Practice, practice, practice. The more NCLEX style questions you answer, the more comfortable you'll become with applying these concepts. Think critically about each patient's situation. What are their most pressing needs? What are the potential risks and complications? Don't be afraid to ask for help. If you're unsure about a prioritization or delegation decision, consult with a more experienced nurse or your clinical instructor. Remember the 5 Rights of Delegation. This checklist will help you make safe and appropriate delegation decisions. Section 9. Conclusion. Your journey to NCLEX success. Mastering prioritization and delegation is essential for NCLEX success and for your future as a registered nurse. By understanding the key principles, practicing with NCLEX style questions, and developing your critical thinking skills, you'll be well equipped to handle any situation that comes your way. Remember, you've got this. Approach your studies with confidence, stay focused on your goals, and never hesitate to ask for help when you need it. You got this. Download our free NCLEX study guide at nursecareerblueprint.com.